Welcome back to Peel Senior Links Aging and Peel series, and we're going to be talking about Peel Regional Paramedic Services, and I'm delighted to welcome to the studio Nicole. Thanks so much for coming.
No problem, Trey. Thank you for having us.
Nicole is the Peel paramedic, and she's the vice president of the Peel Paramedic Association. And we're going to spend some time talking about how seniors access 911 system and being prepared for paramedic arrivals. So first I'd like to go to, what should seniors know about calling 911 for medical emergencies?
Well, I think the biggest thing for seniors to know is not to wait. Quite often we get calls from seniors that it's actually from their family members because they've called their son, their daughter, or someone first to go, what should I do? Well, call us first. As much as it's nice that you want to have that family support, there's a lot of different things that could be going on that we need to treat a lot sooner than waiting for a family member to come in. For a lot of elderly patients wait to call if they're experiencing chest pain because they don't want to be a bother. They don't want to think that, well, I don't want to call at 3 a.m.
Yes.
Well, we're up. Call us. That's what we're here for. We would much rather call or come and see them, you know, if they're experiencing chest pain or if they're short of breath. I mean, strokes is another big one. When they have the one-sided weakness, falls, we'd rather be able to go and get you off the floor, get you the medical help you need. There's a lot of programs that we do now within the Peel Region Paramedic Services that are very time sensitive. We have different bypasses for strokes that require us to be at your residence within just a couple hours of onset of symptoms. And you wait too long, and then unfortunately we can't help you in the same manner. So we have lots of different programs that we can do if you were to come or call us a lot sooner. So that's probably some of the biggest things that they need to do is just give us a call. Don't think you're being a bother.
Right, yeah, I can completely relate to that. As you might know, Peel Senior Link operates supportive housing. And all seniors and quite frail seniors in our program, and even though we have an emergency on call directly to my staff 24 hours, when our worker will arrive, sometimes the seniors are very hesitant in letting them and giving them permission to call the ambulance and call the paramedics. And I guess the way that we look at it is what you're talking about is in terms from a prevention point of view, let's not make that decision. Let's let the paramedic and the hospitals make those kinds of decisions about emergencies. So I think it's an important message for people to feel comfortable that they aren't putting a burden on anybody, that that's your job and you're happy to do that.
That's what we're here for. We want to help people.
That's great. What kind of medical emergencies do you see most often with seniors?
Some of the most frequent ones we see are patients having chest pain, whether it's from a potential heart attack or from other type of cardiac issues that they're experiencing. Shortness of breath is another big one. So just whether or not they already have some sort of disease process going on or just something causing them to just not be able to breathe. Falls is probably the biggest medical emergency that we see. Seniors that they want to maintain their independence and don't necessarily want to have the help there that they can have, whether it be a walker, a cane, or whatnot, and they end up falling and then they're on the floor and not able to get up. I mean, those are some of the biggest things. Strokes are another huge one. And then just seniors that just don't feel right. There's some sort of weakness, or they're dizzy, or they just don't feel right. And I figure if you've been around as long as some seniors have had, you know when you're sick, you know when you're feeling better. So you know if something's wrong, you need to give us a call.
Okay. Just in the falls prevention area, on one of our other shows, we did have a segment on falls prevention, you'd be glad to know. And we've, of course, had Credit Valley, who lead the falls prevention program in the Mississauga area, and working in collaboration with Trillium and also local community support programs through the City of Mississauga Parks and Recreation. So I think maybe one of the messages that I get through here is related to the prevention side of things in terms of seniors having exercise programs which improves their strength, their balance, their ability to better manage those kinds of circumstances, but also even in terms of the environment and the scattered rugs and the concerns about hitting objects. Because I know my mother just recently, she's 88 years of age. She did have a fall, unfortunately. She was very lucky that she didn't hit anything going down. But, you know, she's taken her a number of days just to recover. Unfortunately, she is okay. But we know that these things happen every day.
Absolutely. They definitely do. And there's a lot of things you can do in terms of prevention. You know, non-slip shoes. So make sure you have the appropriate shoes. The scattered rugs, like you said, that's a huge one. Minimizing furniture in the house is another big one, because anything like that puts you at risk for not only if you fall, you might break a hip or a leg, but also you might hit your head on the way down. Those are all things we don't want to see happen.
Yeah. And what about bathroom injuries? Do you typically see those kinds of things where people are in showers, they're getting in and out of the bath, there's slips taking place?
Absolutely, yeah. And there's lots of different medical devices and devices that you can use for those that you can find at some of your local I guess pharmacy stores, things like that, that provide you with aids to better get yourself in and out of bathtubs, so that way you're not, you know, on the toilets. There's different things that can raise the seat, so that way you're at a much more comfortable level, and you'll be much better in the end.
No, really good advice. What can seniors do to avoid some of the emergencies? We're talking about some of those things now, related more specifically to them.
A lot of things that they can do is, well, I mean, a lot of what we just said in terms of the risks of slip and falls. So also using your canes, using your walkers. I mean, you don't want to lose that independence, but they're there to maintain your independence, and if not, give you more independence, because you're going to feel more stable on them. Some of the other things you can do is there's medical devices that you can get, that if you are to slip and fall or you are to do something and you can't get a hold to a phone, you can just press buttons, whether it's a chain around your neck or a wrist, and that gets you 911 attention right away. I mean, never be afraid to call 911. We're always here to help. Another thing is with medications. Some of the other things we see is medication errors, not taking it appropriately. There's different things. You can go to the pharmacy, you can get those kind of weekly packs where you pre-plug in your medication. And you can also get your pharmacist to do that for you as well. A lot of people don't know that that's available to them, is that you can get the pharmacist to set it out for breakfast, lunch, dinner, and bedtime with all of your medications. Plus there's the list there as well. A big thing that you want to make sure is that you have everything together.
Yeah. I think the other thing too is that working with the community, like we are involved with the Lifeline program that you were referring to with the hospitals, and I think it's an excellent service, because you know you are going to be alone at certain times, and if other people don't know that you're there, you could have a fall and you just may not be able to get the support or the help that you need. But what we do also encourage people to do is think about informing somebody if they're going to be alone, and what their whereabouts are and when they're going to be home and when they're not. More typically for people living in a more isolated situation where they just don't have other people around them.
Absolutely.
So keeping family members and others in the community aware that you know, whether they're going to be home or not, and whether people getting concerned about, I haven't seen my neighbor for the last day or two, now I'm starting to get concerned. So yeah,
absolutely, those are
kinds of
always
things.
good things to know. Get to know your neighbors, get to know people, and have people in the ability to call or whatnot.
Absolutely. How can seniors prepare for paramedics, just in case they ever need them?
Well, some of the big things they can do for us is, number one, have their health card ready. Their medications is a huge thing, because their medications not only tell us what they're taking, but they can also give us a lead up to their medical history. If they have the ability to have something in terms of their medical history together, that's even better. Lists are in your wallet, wrapped around your health card. That way we have an opportunity to see medications, allergies, all that kind of stuff. I mean, if you're computer savvy, by all means, set yourself up on a computer where you have your family doctors, you have your medications, what you take them for, your dosages, allergies, your name, your birthday, your health card number, and all that information. You can also go onto the Peel EMS website at www.peelems.ca. We have patient information cards that you can have, and these are kind of similar to what these are exactly what I'm talking about, where you have a small part at the bottom you can put beside your health card, so that way we can do a quick brief information, and then you also have a larger card that you can put somewhere in the house where we can find it, put it somewhere where you know you can tell us when we come, my card's over there, and then we have a perfect indication of everything we need to know in terms of your medical history and personally as well. So all of those things are very important.
That's great. It's an excellent idea, and it's easy, it's simple, it's not hard to do.
Exactly.
I guess the other piece is informing not only individuals but other health professionals. Is that something that the Paramedics Association is involved in terms of working with primary health care physicians in the community, other health professionals?
We do try and really work together with a lot of our community. We do a lot in terms of, through the Peel Paramedic Association, in terms of CPR training, car seats, and all that kind of thing. So we do try to work very closely in promoting awareness of both the profession and of medical information and medical needs within our community.
Yeah. And for seniors who are concerned about making that call, not wanting to be a burden, but also there's other aspects I think that we're experiencing. We're finding that seniors are concerned about going to the hospitals for either acquiring illness, which is something that people talk about, or their concern is I'm going to go there and sit for 10 or 12 or 14 hours. So, you know, maybe I haven't injured myself all that badly, but they can't self-diagnose. I mean, you know, we need a professional to do that for us. Is there a message we can give to the public related to those kinds of concerns about being hesitant to go to a hospital when you really have had an emergency?
I think the biggest thing is just to tell them that if you are concerned, give us a call. Call 911. I mean, there are delays at the hospital, we can't help that. But at the same time, the paramedics are there to help you. We're there, we're able to provide certain types of treatment. We are able to provide better information sometimes to the hospital in terms of what happened than just you coming in with a family member or whatnot. There is a lot of ability for us to communicate directly with the hospitals to provide you with the best care as possible. We can also do a lot of things within the hospital to help get you started if you needed any more further at-home services as well. We have a program where we can refer them to personal support work and get that started within the community. So those are all things that we can do that make it worthwhile to call 911. I mean, it's always something you want to do. If it's a real emergency, or even if you're not sure, just call us, because we would rather come, like I said, check you out, make sure you're doing okay, and make sure that, you know, you're getting the help you need.
So just we have about a minute left. I just want to sort of pursue some thinking about when is it not appropriate to be calling 911? Just to give the public some sense of when is it not an emergency? Is that their own interpretation, or is there any kind of guideline that we can help people with so that they're not using a badly needed service, a critical service, and that somebody else isn't going to potentially be cared for because the line is being consumed by individuals that maybe aren't using alternate services?
Yeah, I mean, when talking strictly about the seniors' perspective, I mean, they have a lot of what we call co-committal diseases. So other things that can factor into what could be just a minor issue. But I mean, if it's a small laceration and you have the ability to get to a walk-in clinic, your family doctor, or like an urgent care center, then absolutely you can go with a family member. But I mean, if at any time you're not sure, you're better off to give us a call at any time.
Well, thank you very much, Nicole. It's been very informative. We'll look forward to seeing our audience back shortly. Thank you very much.